PICO question was, in patients with diabetes, what is the effect of diabetes education compared to little or no education on diabetes self-management? The databases we used to find current evidence included UC Library and CINAHL, and the keywords we used included diabetes, self-management, self-care, and education. Some limits we used to narrow down results included peer-reviewed articles, the English language, and we wanted all of them to be no older than 5 years. Diabetes education is such a crucial topic in healthcare because so many people worldwide and nationwide are affected by diabetes. By giving them the proper tools and resources, they can learn to independently manage their diabetes and have a better quality of life.
My name is Allie, and I was diagnosed with type 1 diabetes on December 10th, 2008, so I've been diabetic for 10 years. I learned what diabetes is and what insulin is. I learned carb counting and different ratios for it. I learned what blood sugar should be and how to regulate it, and I also learned how to give myself an insulin shot. The diabetes education that I got helped me to maintain and better manage my diabetes and gain confidence. So I only got 3 days of education for this lifetime disease, so I wish they had like a continuous education for my diabetic journey. And another thing I wish they taught me were the long-term effects of diabetes and the complications that come along with it, because they really seem to downplay it. And it's probably because there are a lot of people with diabetes in the world and they're so used to it, but it was really life-changing for me.
In our research articles, they used diabetic patients as the population in different countries, such as Turkey, Kuwait, Iran, and the US. Collectively, our articles showed that implementing diabetes education improves hemoglobin A1C levels, self-care, and blood sugar self-monitoring.
For the synthesis of our evidence, we used 2 randomized control trials, 1 retrospective quasi-experimental study, and 1 qualitative study. The overall rating of our evidence is a level 3 quality A. Overall, our articles provided consistent evidence with definitive conclusions.
The UC Health Endocrinology, Diabetes, and Metabolism Center currently offers treatment for patients with type 1 diabetes, type 2 diabetes, gestational diabetes, and hypoglycemia. They currently provide individual and group classes to allow patients to better improve their lifestyle and manage their diabetes. Education sessions tend to last 30 minutes to an hour, and patients receive an average of 2 to 3 sessions. Current evidence supports current clinical practice.
Based on the evidence gathered, a few recommendations are to continue the group and individual sessions offered to patients as they are showing effectiveness in self-management. Before this can occur, however, evaluating patients' willingness and readiness to learn is an important first step. Determining how each individual patient learns can make an impact on the quality of the education session.
Another recommendation is to increase the education sessions for each patient and encourage long-term follow-up visits. Teach-back methods should be emphasized to allow patients to manage their diabetes independently. Ensuring the patient's confidence in the skills taught during the education sessions is a crucial step in evaluating self-management.
Another recommendation for education can include setting small goals that will lead to permanent lifestyle changes. During education sessions, the educator should allow sufficient time for the learner to express concern or ask questions. The most important aspect moving forward is to provide consistent education and encouragement throughout their disease process.
Implementing these recommendations and encouraging our patients with diabetes will lead to positive outcomes and a better self-management.